I want to welcome you to Stop the Stress, an authentic look at stress and dentistry with Dr. Bethany Physics. Just a moment before Dr. Bethany comes on, what I want to tell you is a little bit about GoToWebinar. GoToWebinar has a great panel in it where you can ask questions directly to us as we're going through the presentation. And I encourage you to do that. If you have a question that comes up for you as we are going through the presentation, please feel free to type it into that area. We do have some question period scheduled for the end of the webinar. Right now, I am going to turn things over to Dr. Bethany, and she is going to talk with you about how to stop the stress in your dental practice. Dr. Bethany, take it away.
Thank you, Kim. Thank you for hosting for us this morning. And welcome to the webinar, everyone. Thanks for taking the time to be here. I know for most dentists, Fridays are your day off, but who's kidding who? Most of us are at the office catching up on everything we didn't do during our week of seeing patients. So thanks for taking time out of that to come here. I'm honored to have you. So this webinar is about 30 minutes long plus questions. So if you have questions, like Kim said, just type them in and I'll answer them as soon as possible at the end. So today I'll be talking about stress and anxiety, not in general terms, but for dentists in particular. And I'll be giving you some specific ways to feel less stressed. We do, as dentists, live in our own corner of the world. I call it Dentistville. And no one really ever gets what it's like to be in Dentistville unless they've lived there. By the way, there's approximately 190,000 practicing dentists in the United States, so that is the population of Dentistville. A little trivia for you. So we're going to look behind that curtain into Dentistville and address specifically what is stress and what is it that makes our profession in particular so stressful, how intense chronic stress can impact your life, and look at some specific ways to deal with stress, which includes a unique, powerful, proven new technology that naturally removes patient anxiety from the equation, and it will transform your days at the office. I wish I would have had this technology when I practiced, because it would have been a game changer. So don't miss this last portion of the webinar. That'll be at the end. So let me begin by telling you what motivates me to do this webinar and why I'm so passionate about reducing stress and anxiety for dentists. So for those of you who don't know me, I practiced dentistry for 20 years in Cadillac, Michigan, a little small town, very industrial town. And this is a picture of me standing on my sign. I'm peeking around there, and that's my building that I built. Yeah, so I was buried in debt. I was struggling with team and leadership issues, patient demands, always demanding things and wanting their treatment to last forever. I was unhappy with my clinical skills, definitely being my own worst critic. And I was very overwhelmed, reaching the point of mental and physical exhaustion and even burnout. So there were many days I wanted to drive away and just never look back, change my name, start over, let it all go back to the bank. But I didn't do that, which was good. But it was a very dark time in my life, and I desperately was looking for help. So as you know, dentistry is not easy. So to make a long story short, I changed my life. I hired a coach who was also a dentist, and he helped me transform my practice into a balanced, productive, and enjoyable place to work. So it can be done. I was in a very dark place, and through the coaching, I was able to transform the way I spent my days and the productivity to fit my life. So he helped me transform myself into the person I wanted to be. And most importantly, he made me realize my true passion was to pass this coaching gift forward to other dentists and help them stay out of that dark place before it's too late. So horses have also always been a passion of mine. And here's a picture of me coaching a client. That's my horse Lewiston, and we're in a round pen in Arizona. This is a few months ago. What I did was combine my passions of coaching and and horses, and I acquired a certification in equine gestalt coaching. And I left clinical practice 2 years ago and founded Braveheart Equine Coaching. So I'm now offering a service that is unique in all of dentistry. I partner with horses to help coach dentists to a better life. And my main focus is on the business aspect to help dentists reduce stress by getting a handle on their finances. So much more about the horses and equine gestalt coaching in another webinar. Today we're focusing on stress reduction. So that's the mission of Braveheart. For more information about Braveheart, just go to my website, braveheartequinecoaching.com. In here you can also schedule a free 30-minute exploratory call if you're interested in more information on how Braveheart can help you. So let's start with a definition of stress. And a very formal definition is a physical, chemical, or emotional factor that causes bodily or mental tension that can alter an existing equilibrium and is a major factor in disease causation. I can feel everyone's eyes glazing over as this definition just brings us right back to lecture hall in dental school and makes you go to sleep. So let me say this in a different way. Stress is a lot like perio. It's a silent, creeping, destructive force that builds up over time and wears you down as your defenses weaken. And so much like perio, it's easy to ignore until it's too late. The damage has been done and you've lost pieces of yourself. So really take that in for a moment. It's the most accurate way I can think of to paint a clear picture for you as to how stress is eating away at your life. Mostly under the radar. As you know, perio is painless. So it's something we tolerate just like perio can be. And when you're finally forced to take a look at it, the destruction and the smell can be overwhelming. So always best is to treat it early. So dentistry is an extremely demanding profession, physically, mentally, and emotionally. It's an issue. Stress is an issue that's felt on a daily basis by dentists, sometimes very intensely. It's not spoken about very often and definitely not dealt with very well. I'm going to tell you a story relating to my own experience about that. When I was in my toughest times, I remember a specific day when the stress just came crashing down on me. I hadn't been sleeping well. And, waking up in the middle of the night with my mind, in a whirl. And I've been giving up my lunch hours on a regular basis, trying to increase my numbers, my production, and, feeling like I was being a hero for others, but putting myself last. And my energy reserves and ability to deal with the stress were both on empty. So, one typical day, an emergency patient was placed in the schedule right before lunch, which is never good, and I had asked my team not to do that, to schedule emergency patients before lunch, but I had been violating my own guidelines and principles, so they felt that if I'm violating it, they can violate it too, so I can't blame them. It's hard to resist to add some major production possibility in the schedule, especially when there have been no shows in the same day, so I agreed to see the patient, and they ended up needing a surgical extraction, which, that shouldn't take too long. So let me mention extractions were on my list of my least favorite procedures, so I almost always referred them out. And I had a pact with myself that I would always refer them out, and I broke that one too. So now I'm violating 2 of my guiding principles. I was already overstressed and tired and missing lunch, and so needless to say, the procedure did not go well. I fractured the root, couldn't retrieve it, and spent my whole lunch hour trying, ended up referring it out, and collected only an exam and x-ray fee. You've all probably can relate to that. So how often do we not listen to our own intuition or follow our own guidelines and end up paying a huge price? So the price I paid was I got so ill later that day, I missed 3 days of work, 3 full days of production. And that was so rare. I almost never took a sick day my whole career. And I was out for pretty much the whole week. And I feel like that was the straw that broke the camel's back. So it's a big price to pay for not taking care of myself. And I'm sure you can all relate to that story. So we hear all the time that the suicide rate of dentists is one of the highest in the professional world. And for some odd reason, our patients enjoy reminding us of that. I remember hearing it every week a few times. It was so strange that they would say that, but they do remind us of that. Another stunning piece of information is that stress-induced early heart disease is the #1 way dentists are dying today. Stress-induced early heart disease. So it's serious. I know many dentists in their 50s who have had cardiac procedures and have lost some friends and colleagues to suicide. So it's an issue that can't be ignored. So as I mentioned earlier, dentists endure significant stressors every single day. And the most common, the top 5 that are experienced every day, #1, time pressures. We have to stay on time. Our patients want us to be on time. They don't want to wait even 5 minutes in the reception area. Our hygienists are tapping their foot. They need their exams done, and we don't blame them. They don't want to be late either. But we're working in an environment that's unpredictable, and we can't always know how it's going to go. We're trying to keep a wet area dry. We can't see, and things happen. So time pressures every single day. Patient demands. Patients can be very demanding, and they always expect that our treatment will last a lifetime. And sometimes they don't want to pay for it either. So anxious, fearful, or uncooperative patients. Have you ever had a day when you have no patients who are fearful or anxious or scared? I don't remember one day in my career when I didn't deal with that. So another stressor is every single day. As a dentist, it requires high levels of concentration and focus. And we have to make so many decisions on a daily basis. I used to tell my team they get 3 questions a day because they would ask question after question, and I get so tired of making decisions, and I'm trying to focus on my patient care, and it's a daily stressor. And finally, last but not least, team and leadership issues. Always trying to be a good leader, and you take all the credit for the things that happen that are negative, but you don't get much credit for the things that happen that are really great. So you have to give your team credit for those things. You all know how that goes. So also, I believe that the anxious, fearful patient part of it, I feel that sitting next to them for hours at a time is probably the most negatively impactful stressor that we face. Remember, the emotional system is open, meaning if you're sitting next to someone who is strongly emotional, say they're stressed or scared, within a few minutes, their mood becomes yours, and your physiology actually changes to match theirs. So there was actually a study where dentists were giving anesthetic to patients, and the patient's physiology caused the dentist's body to, the heart rate went up, blood pressure went up. So imagine the effect of this over years of practice. It's a huge problem, less noticeable when we're young, but can take a big toll. So extreme stress and tension can physically affect every system of our body, and stress promotes acidity, which is a catalyst to 95% of diseases. So all the physical problems here can be a result of stress. So what do we do about this? How can we better deal with these chronic everyday stressors that aren't going to go away? You know, we can't get rid of our team. Well, I guess we could, but it'd be pretty stressful to do that too. So dealing with them is definitely an inside job and a decision we have to consciously make every single day. So I promised a few things you can do, some tips that are immediately useful. I'm going to give you a few of the things I did and still do every day that can lower your stress level. And this is specifically targeted at dentists. And then I'll introduce you to the most powerful, researched and patented neuroscience technology on the planet for stress and anxiety reduction. Using it will change your life and is a game changer personally and professionally. So first, a few tips you can start using today. Besides all the normal tips you hear on Facebook, eat healthy, exercise, drink water, get sleep, etc. My number one tip, and this is a tip I got from my coach years ago. Do something you love every single day, even if it's for 5 minutes. I thought, when he told me this, I thought, you are crazy. How is doing something I love for 5 minutes going to get my clinic notes done and help me make the decision about this treatment plan, and how's it going to get my laundry done, and all these other things? And I really resisted this tip, but it was the best advice I ever got, because what it did is it allowed me to shift my focus to a positive, something positive that I get to look forward to. It helped me feel better, and doing something I loved filled me up. We have to fill ourselves up. It made everything else a little more tolerable. So make a list of things you love to do and take time to do one of them every single day. The next tip is to breathe deeply, especially during long, difficult procedures. Remember to take some deep, slow breaths. It increases your O2 saturation, stretches your lungs, and it reminds your body to relax. So one thing I did, I always breathed deeply while the curing light was on, instead of impatiently waiting for that beep. You know how you sit there and you're grinding your teeth, losing enamel by the second because your hygienist is waiting. But there's nothing you can do except wait for that curing light, so you might as well take some deep breaths. It's a big difference because it happens a lot during the day. So also on those, when you might wake up in the middle of the night unable to get back to sleep, here's a breathing technique that helps me get back to sleep every single time. So I learned this in a yoga class. It's you breathe in for a count of 4. So pretty quick, breathe in as deep as you can for a count of 4, hold it for a count of 7, and breathe out for a count of 8. So guaranteed, if you do this, in for 4, hold for 7, out for 8, by the time you do that 4, 5 times, you're either going to be back to sleep or very relaxed. Your mind is on something different, something relaxing, and you're going to go back to sleep. So try it. The next tip I have doesn't seem like it has anything to do with dentistry, and it can apply to anyone. Do highlights in the evening at the family dinner table, or if you don't have dinner with family, you can do it at bedtime or whatever you want to do. But highlights are the best part of your day. So what you do is you share the best part of your day with whoever you're having dinner with, and what it does is it shifts your focus. So all day long you're looking for a highlight, and pretty soon you have more highlights than you can't even decide which one to talk about. So remember, what you focus upon expands. So after a while you might have to go around the table 2, 3 times and tell everybody what the best part of your day was. So this changed my life. This was a very impactful tip. The next tip, which is also, these are all really, really important. Take at least 8 weeks off a year. Now I know it seems like I've lost it, but guaranteed your efficiency, production, and creativity will all increase to make up for the missed time. And your body, mind, and spirit will thank you. You'll be filled up. Your team and patients will love the re-energized you. It's just not fair to the people around you or yourself to drag yourself into work on empty all the time. So this is another focus I have in coaching, is I teach people how to take more time off per year and maintain or increase their collection numbers. Highly impactful and so helpful. The next tip is to hire a coach, and I'm a big believer in having a coach. I had a coach since 2001, and I can't imagine life without having that guidance. So does anybody have a kid on a sports team, soccer or something? They go to practice, there's always a coach. So why? I mean, what's the coach's role? Imagine a game of soccer without a coach. It would be chaos. They keep the kids focused on the game, help them utilize their natural abilities and develop their other skills. They're encouraging. They find positive aspects of each player and help them keep a positive attitude. So that's what coaches do in business too. Most of us live our lives just moving through the days, focusing on whatever is in our face or making the most noise instead of on what's important and productive. So a coach helps you to stay focused. Dentistry also can be a lonely profession, and most of us practice solo. So, you know, it's hard to shoulder the responsibilities that we have in Dentistville alone and have no real support. Coaching provides an ally and a support system that's extremely useful during stressful times when it's challenging to think clearly. You can't see the forest for the trees. Coaching also creates clarity on what you really want in life. It's a fresh perspective on challenges, objective viewpoint. So it provides wisdom and creative thought and helps you uncover possibly unexplored options. So again, if you'd like more information about coaching, go to my website, braveheartequinecoaching.com, and schedule a free 30-minute exploratory session with me to find out more. So last but definitely not least is the technology I promised to tell you about. It's called NuCalm. Some of you may have heard about it. NuCalm is the only patented, proven, all-natural stress intervention technology on the whole planet that interrupts adrenaline. It interrupts the adrenaline response and induces total relaxation within 5 minutes with no drugs. So the only side effect is feeling refreshed and sleeping better at night, and it puts you into a deep meditative state. So how would working on relaxed patients all day long change your life as a dentist? We talked about that earlier. It's physically important and emotionally important. So I'm talking about this here because reducing stress for dentists is my focus in life, and this is the most powerful tool I've ever discovered in my search for ways to do this. This is a concrete way to do it. So think about all the issues you deal with every day because of nervous patients. They talk a lot, they're tense, they gag, lots of saliva. A lot of them need extra anesthetic. They're in a hurry. They go to the bathroom in the middle of your procedure. Some of them even tell you they'd rather be in labor than be in your chair or pass a kidney stone. And that's just, the things people say to us, seriously. But most importantly, anxious patients negatively affect your body just by being next to them and contributing to the stress-induced problems, heart disease. It is contagious. So NuCalm puts the body into a parasympathetic dominant state, meaning rest and digest instead of fight or flight. And in this state, you're physically incapable of having an anxious response. So this is the state you want your patients to be in. By the way, NuCalm is not just for our patients. Using it yourself will balance your autonomic nervous system. If you have trouble sleeping, it helps with that, improves sleep quality, boosts the immune system, and helps you focus. So what does NuCalm look like? Let me show you a picture here. This patient is wearing NuCalm. So there's headphones, an eye mask, and you see the wires at the bottom. I'll explain those. So there's 4 steps to administering NuCalm. First of all, there's an all-natural cream. It contains amino acids that interrupt the adrenaline response, and they facilitate relaxation. It smells good too, so it's good aromatherapy. And you apply the NuCalm cream in the carotid area of the neck, and it's absorbed very quickly. Super easy to do. The next step is it's the CES unit, Cranial Electrotherapy Stimulation. That sounds pretty bad, like, oh, we're getting shocked, but no, it's subsensory, and these little sticky pads go right behind the earlobes. It increases the effectiveness of the cream to put the body into a state of deep relaxation. So here's the next picture is showing applying them. They go right behind the earlobes there, and turn the unit on. The patient doesn't feel anything except relaxed. The headset contains neuroacoustic software, and this is where most of the relaxation happens. The patient only hears instrumental music, but there's 8 years and over $3 million worth of research in these headphones, and it entrains the brain into alpha and theta states, which is the state just before you go to sleep. You know, that blissful state when you're just about to go to sleep. That's where the NuCalm holds the patient. So it's really nice. So we turn on and place the headphones, and they just hear the instrumental music. And the last step is the light blocking eye mask. It results in more alpha brainwave production. So you can also use real dark sunglasses if people don't want to have a complete eye block. Some people are a little nervous about that. So I've never experienced such a concrete way of reducing stress. Let me tell you quickly my personal experience with NuCalm, and then you'll know why I'm so excited about it, because I never got to use it as a practicing dentist. But I found out about it a few years ago, and I got to try it at a dental meeting last year, and I loved it. I purchased a unit for myself, but I was just using it, you know, in my house. I'm laying on my couch using it, and it really did help. It was nice. But then I found out I had to have a filling done. And I thought, well, I'm taking the NuCalm in, and I'm gonna find out what it does as a patient. So I took it to my appointment, and I placed it on myself, and my dentist is like, "What's this?" You know, and he's pretty excited about it now. But anyway, I placed it, and I'm not the most calm dental patient. I'll admit, you know, I sit there and worry about, did they put enough desensitizer on? Is the margin look okay? Did you use the indicator for decay? And, you know, I want to check their work. So this really chilled me out. I was so happy. I could have laid there literally, and I'm not kidding. I didn't want it to end. It was such a nice experience. It was like I was laying in a warm bath of water in a whirlpool, and it was just amazing. And it took so much stress out. So when I was done with my appointment, I felt refreshed, and I was happy, and I was happy to go pay the bill. Imagine that. Imagine if patients are happy to pay the bill. What a difference it made. So if you have a chance to try it, do. And if you're in Michigan and would like to try it out, give me a call, and I will let you demo a unit. And if you decide that you want to order one, you can mention my name or this webinar, and they're going to give you special pricing on your purchase. So let me...
Well, Dr. Bethany, I think you've given us a lot of really good tips on how to reduce stress, and some great information about NuCalm. I want to encourage everyone at this point, if you have any questions, to please go ahead and type those into your question area. I also would like to invite you to come to a retreat that Dr. Bethany is doing on dentists, money, and stress. Talk about 3 awesome things to talk about. It's a 3-day retreat that will change your life, and that's in November in Amherst, Virginia. Dr. Bethany, would you like to tell folks a little bit more about that retreat and why they might want to come?
Sure, just real quickly. I mean, as a dentist who practiced for many years, I know that a lot of the stress, besides patient anxiety, comes from money, debt, paying the bills. It seems like we're always working to pay everybody else, and we get paid last, if at all. I mean, there were times I didn't take a paycheck. So the retreat is going to be focused on dealing with beliefs about money that may not be serving us anymore. Maybe beliefs we learned as a kid or as we grow up. Some people think money is evil. Why would money come to you if you think it's evil? Things like that. So also we'll be working on some concrete ways to increase the collections and production in your practice without increasing the working days. So this is a great time to come to Amherst, Virginia when the weather starts to get nasty around the northern parts of the United States, and extend your summer a little bit and come and learn about dentist money and stress and how to reduce the stress in your life.
That's awesome. And I can tell you from personal experience that the facility in Amherst is absolutely beautiful. It is one of the most peaceful places that you will ever find on the planet. And it's amazing. The horses there are amazing. It's very, very beautiful. And I would highly recommend going to this retreat. So now we're going to move into the question portion of our program. And we do have a couple of questions up. So the first one comes from Doug. Doug wants to know if there are any contraindications regarding NuCalm, anything that he might need to know about using NuCalm.
Oh, sure. Yeah. There's a couple contraindications to some parts of it. For instance, pregnant women are not supposed to use the cream, but they can still use the CES unit and the headphones, and it will still make an impact. It just won't be quite as profound. Another contraindication are people with pacemakers or defibrillators implanted for their heart. They shouldn't use the CES unit. So anyone else can use all parts of it, and even the ones that, like the pacemaker patients, they can still use the headphones and the cream. So there's not a lot of contraindications to it at all. Thank you for your question.
Oh, great. Doug says thank you, by the way. Our next question comes from Mary, and she says, I don't know much about horses, and I'm a little don't understand quite where the horses work into your work. She wants to know if she has to work with a horse, and if so, what can you tell us about horses involved with Braveheart equine coaching and helping dentists be able to reduce their stress level?
Sure. Well, the horses are a big part of what I do. They're not everything that I do. So if someone is completely against working with a horse, then we can do phone coaching or, other ways. You don't have to work with the horses. But one thing about working with them is that if you're afraid of horses, and that's why you don't want to work with them, think about the fact that we're asking our patients every single day to face one of their greatest fears, because we know the benefits of facing that fear, having a healthy mouth, which leads to a healthy body, a beautiful smile. So there are also benefits to overcoming the fear of a horse, because the horses have a message for you. And in order to find out what that message is, you have to come and see them. So I'd encourage you to, think about working with the horses, but it's definitely not required.
Awesome. Okay, our next question comes from Linda. And Linda would like to know more about how she could become a coaching client. She's very interested in that and would like to know the specifics of maybe what that would entail.
Sure. Well, the first step is to go to my website, braveheartequinecoaching.com, and there's a place you can sign up for a free 30-minute exploratory coaching call. It pops up when you're on the home page, so you can sign in, and then you can pick a time. There's certain times that are available, and you sign up for that, and we'll talk for half an hour, and then we go from there based on what your personal needs, challenges, and desires are. So it's all customized, and then what we do is it's like doing a new patient exam, comprehensive exam, and then I write up a treatment plan and then present the treatment plan, and we go over all the details of it. So they're very individualized. Some people coach for 6 months, some people coach for 2 years. It just depends on what you are wanting to work on. So I hope that answers your question.
Yes, thank you, she says. And our next and our last question, if there's anyone else who would like to ask a question, please feel free to do so before we close the call. The last question comes from Jim. And Jim says he's very interested in being involved with coaching, but wants to know if there are any options where he could bring his entire team to work with you, or if there's any team options where you would work with an entire office of dentists.
Sure. Yeah. So what I do is I do coaching mostly on the phone because it's all over the US, but then I do retreats for dentists only, which is the one coming up in Virginia in November. I do at least 2 of those a year. And then we also do single office team retreats where you would just bring your office to a retreat with the horses. It's usually a day and a half. And we work with the team and we work on deeper understanding of each other, relationships. We work on, there's always that team dissonance that gets in the way on a daily basis, that one person who always causes problems and the one person who doesn't do enough work or people think they don't. So we bring the team together in a way that's very, I want to say, unique. And the horses help people to see how they're responding to the world in a way that's more clear than can be seen in an office environment. So working with the horses is impactful, and the teams walk away with a whole new outlook on each other and working together, and they have the ability to, they all grab an oar and they're rowing to the same destination after coming to a team retreat. So thank you for that question.
And one more little follow-up question to that. Is there follow-up? Do you follow up after the team comes and works with you? Do you have like a plan that goes on for a period of time, like coaching an entire team for, I guess, follow-up afterward?
Well, it depends what the dentist wants, and sometimes I've done team, we do team retreats once or twice a year. So I don't go to the office and follow up with the team, no, but I follow up with the dentist on phone coaching for sure. And then if they want to do another team retreat, that's an option.
Perfect. Well, I would like to thank you all for coming today and listening to our webinar. And I'm sure Dr. Bethany would like to say a couple of final words to just thank you for being here as well. Just a couple of housekeeping details. We did record the webinar today, so we're going to be emailing that to you later over the weekend or Monday. And I encourage you, if you know another dentist that is suffering from stress or is just maybe could utilize the information that is contained in the webinar, please feel free to forward this on and share it with your friends. If you are an individual on the webinar and you have your dentist, please feel free to share it with them. We encourage you to do that. The information that's contained here is educational and inspirational, and I hope that you will share it with as many people as you can. Again, go to the website and take a look around. And we will be in touch shortly. Dr. Bethany, do you have anything you'd like to say to close out our day?
Yes, just thank you so much for taking the time. I hope it helped, and anything I can do to help reduce stress and anxiety and dentists' lives, I'm so happy to do. So contact me and enjoy your weekend. Thanks so much. Do something you love. Go do something you love. Thank you.
Thank you again, everyone. Have a great weekend.